everyone, welcome to my channel. In this video, I will be talking about rheumatoid arthritis. This video will be covering the etiology and pathophysiology, clinical manifestations, diagnostic studies, as well as the medical and nursing interventions associated with rheumatoid arthritis. If you found this video helpful, please give it a like, and if you want to see more content, please consider subscribing to my channel. So rheumatoid arthritis is basically a type of arthritis that is characterized by autoimmunity and inflammation of the synovium. Unlike osteoarthritis, where it mainly affects only certain weight-bearing joints unilaterally, rheumatoid arthritis affects the body symmetrically and bilaterally. In addition, whereas osteoarthritis typically affects people above age 60, rheumatoid arthritis can occur at any age between 20 to 60. The specific etiology for rheumatoid arthritis is unknown, but it is likely from a combination of genetic and environmental factors. The most widely accepted theory regarding the cause of rheumatoid arthritis is the autoimmune theory. The autoimmune theory starts off when a certain type of antigen triggers the development of abnormal IgG, which then leads to the formation of autoantibodies called rheumatoid factor, which then form an immune complex with IgG. These immune complexes then deposit into the synovium of the joint, triggering an inflammatory response. So here is a diagram that further highlights the pathophysiology of rheumatoid arthritis. This part of the diagram shows where the white blood cells start to cause inflammation at the synovium, which is also called synovitis, causing cartilage destruction. Then the second part shows pannus formation, which is the formation of fibrous connective tissue, which causes further damage. The third part illustrates the decrease in joint space as a result of cartilage and bone destruction. Then the fourth illustration shows ankylosis, where the bones ultimately fuse together, causing stiffness and immobility in the patient. So this diagram shows the clinical manifestations associated with rheumatoid arthritis. In the preliminary stages of the disease, you would see nonspecific manifestations such as fatigue, weight loss, and loss of appetite. Since rheumatoid arthritis is characteristically inflammatory, you would see patients with inflammatory manifestations such as tenderness, warmth, and swelling to the affected joints. Affected joints span a broader range such as the hand, knees, and wrists, which is in stark contrast with osteoarthritis, where it affects mainly weight-bearing joints. You would also see morning stiffness that lasts for more than 60 minutes. And unlike osteoarthritis, where manifestations are more local and unilateral, rheumatoid arthritis affects the body systemically and symmetrically, so you would see cardiopulmonary manifestations with rheumatoid arthritis. As the disease progresses, you would also see varying types of deformity in patients, as we will discuss in the next section. So here's a diagram that illustrates the different types of deformity that come with rheumatoid arthritis, starting with an ulnar drift, which basically means the fingers will drift towards the pinky side, which is where the ulnar bone is located. A hallux valgus or a bunion can also be present in rheumatoid arthritis, where there would be a big bump at the base of the big toe. Buttonier's deformity is also present in rheumatoid arthritis, where there is flexion at the proximal interphalangeal joint or PIP joint and hyperextension at the distal interphalangeal joint or DIP joint. A swan neck deformity is basically just the opposite of Buttonier's deformity, where there is hyperextension at the PIP joint and flexion at the DIP joint. So with diagnostic studies, a comprehensive history and physical is particularly helpful in the diagnosis of rheumatoid arthritis due to the fact that the disease itself has a strong genetic and environmental component. Certain labs such as a positive rheumatoid factor are present in patients with rheumatoid arthritis, going back to how rheumatoid factor binds with IgG, forming an immune complex in the synovium, as discussed in the pathophysiology sections. Other labs, such as an elevated erythrocyte sedimentation rate and C-reactive protein or ESR and CRP respectively, tend to be present, as both markers tend to indicate inflammation, which is characteristic of rheumatoid arthritis. A positive anti-citrullinated protein antibody is also present in rheumatoid arthritis and is typically more specific to RA than rheumatoid factor. Elevated white blood cells tend to be associated with rheumatoid arthritis due to the fact that rheumatoid arthritis is an autoimmune disease, thus with heavy involvement of the immune system by way of white blood cell activity. Synovial fluid analysis and tissue biopsies are also particularly helpful to analyze the extent of inflammation at the joint. When it comes to medical and nursing interventions, the primary goals for rheumatoid arthritis are to detect the disease early, delay disease progression, preserve joint function, and manage pain. The types of medications used in rheumatoid arthritis, as well as educational pieces in managing rheumatoid arthritis, will be covered in the following sections. Physical therapy and occupational therapy are services that serve to both preserve joint function and mobility, as well as providing assistance with how to perform ADLs, thus promoting safety. Surgery is often reserved for cases involving severe damage and deformity caused by rheumatoid arthritis. Specifically, a synovectomy or removal of the synovium, or an arthroplasty, which involves the removal of the entire joint. Medications used to manage rheumatoid arthritis are NSAIDs and salicylates, DMARDs, or disease-modifying anti-rheumatic drugs, and biologic and targeted therapies like tumor necrosis factor inhibitors. In mild to moderate cases, NSAIDs and salicylates are used to treat arthritic pain and manage inflammation. Examples of these medications are ibuprofen and aspirin. DMARDs, or disease-modifying anti-rheumatic drugs, are also used to delay the effects of rheumatoid arthritis. Examples of DMARDs are methotrexate and leflunomide, but it's important to remember that leflunomide blocks immune cell production, thus preventing inflammation in RA, but is considered teratogenic, so make sure to assess patients and ask if they have any plans to have children. Such therapies include tumor necrosis factor inhibitors like etanercept or Enbrel, which blocks the inflammatory response associated with RA. However, it's important to note to avoid giving live vaccines to patients with this medication, as these patients will have a suppressed immune system. The goals with educating a patient with rheumatoid arthritis is to preserve joint function, prevent deformity, decrease pain, and conserve energy. Teach patients to regularly perform range of motion exercises to preserve joint function. However, during an acute flare-up, teach them to immobilize the affected joint instead. Application of splints are a good way to immobilize the affected joint, decreasing pain and deformity. Also teach patients to batch tasks and plan their day carefully, and the purpose for this is to conserve as much of their energy as possible and manage fatigue. Also reinforce eating a balanced diet to maintain an ideal body weight. Also teach patients to apply heat to decrease stiffness and ice to decrease pain, but remind patients that hot and cold applications should not be used for more than 20 minutes for hot applications and 10 to 15 minutes for cold applications. And that is it for the video. If you found this video helpful, please give it a like, leave a comment below, and again, please consider subscribing to my channel for more content.